Type 2 diabetes is a progressive disease in which the risks of myocardial infarction, stroke, microvascular events, and death are all closely related to hyperglycemia. The disease process is mainly characterized by impaired beta cell function and worsening insulin resistance. How quickly does type 2 diabetes progress? Type 2 diabetes tends to develop more slowly than type 1 diabetes. So it often takes a few months or even years for a person to know they have this health problem. Type 2 diabetes can also result from prediabetes. In addition, symptoms can appear very slowly, which makes detecting signs of disease more difficult. In addition to common identifying features such as poor vision, nausea, dizziness, and frequent urination, symptoms of type 2 diabetes can include dry mouth and sore feet. Why does type 2 diabetes get worse? In typical cases, when people with the disease have failed to control blood sugar due to poor diet and lifestyle, metformin should be used. As the years go by, the patient will seem to feel that the disease is getting worse, along with having to take more and more medications to treat the disease such as gliclazide. If the condition is still not well controlled, you may need to take insulin. In essence, slowing the progression of type 2 diabetes is often the desired goal. Type 2 diabetes presents and causes a range of complications including retinopathy, damaged vision, neuropathy, damaged nerves, and kidney disease, damaged kidneys. Having diabetes also increases your risk of heart disease. Weight loss and lifestyle changes help reduce type 2 diabetes. There was once a perception that it was impossible to slow the progression of type 2 diabetes. Fortunately, this is changing rapidly thanks to a combination of many different factors. In the past, type 2 diabetes was seen as a one-way street, a chronic, progressive, and irreversible disease that requires increased medication intake to control over time. Currently, more and more research has shown that if you know how, you can reduce the progression of type 2 diabetes. What does remission of type 2 diabetes include? Diabetes remission means that your blood sugar reaches a healthy level without having to depend on any anti-diabetic medication. Stable remission, within a year or more, your HbA1c will be in the normal range and your blood sugar will be stable without the use of diabetes medication. However, you still need to be checked for blood sugar, blood pressure, cholesterol, and kidney and eye problems. Prolonged remission, within 5 years or more, HbA1c and blood sugar levels are normal without the use of diabetes medication, the condition is considered to be in prolonged remission. On the other hand, you may still need regular check-ups to prevent any heart, eye, foot, or other health problems you have from diabetes, even if they improve. Better than before. How to reduce type 2 diabetes. How to prevent the progression of type 2 diabetes from turning bad, or more specifically, to reduce the condition is in the minds of many patients. To do this, you can refer to support measures, such as mix a variety of foods. Carbohydrates raise your blood sugar higher and faster than any other nutrient. Therefore, choose foods with protein, good fats, and fiber as well as specific nutritional products for diabetes because they do not raise your blood sugar. Healthy lifestyle. According to experts, you should drink a lot of filtered water, stay away from tobacco smoke as well as have a suitable exercise regime, 100 to 150 minutes per week. Besides, avoid sitting for too long as well as lose weight if you are assessed as overweight. Know your HbA1c. The HbA1c test will help you see if you've managed well over the past few months. Therefore, consult with your doctor about what you can do to best regulate your blood sugar. Signs that type 2 diabetes is getting worse. There are many people with diabetes who are unable to realize that their health condition is on the verge of worsening in a timely manner. The reason is that they do not recognize the warning signs. Here are some signs that diabetes has signs of worsening due to ineffective blood sugar control. Signs include urgent urine, loss of taste, numbness in hands and feet, visibly weak eyesight, weight loss for no reason, skin wounds take a long time to heal, Can you live a long life with type 2 diabetes? Type 2 diabetes is a serious health condition with a high risk of complications, even life-threatening. However, if you apply effective disease management measures besides taking medicine, you can still live a long, productive, and happy life with your loved ones.